give this a couple minutes as we get everyone dialed in and logged in. All right, we're getting everyone off their prior calls into this one. Lindsay, why don't we put up the introduction slide? We can mosey on towards the start of this thing. Julie, you about ready to go?
I am.
Get all right. Well, let's do the introductions then. Welcome to the February Fireside Chat, everybody. We took January off. It's good to see everybody dialing back in. And as everybody's aware, we've got a new president in office. And with that, a lot of changes taking place out in Washington, D.C. And so the timing of this fireside chat is fantastic. Should be plenty to talk about. So joining us today is Julie Barnes. She is the founder and CEO of Maverick Health Policy. She's located in the heart of it all back in Washington, D.C. And I want to thank her because I know this week she's had a lot of travel and several other presentations and is squeezing us in between all of that. So she's got a lot going on. But will be with us for the next hour to go through, political leadership changes and impacts that has on policy. So she works and consults with organizations on just that, what those federal policy impacts would have, and we're going to be talking through those things today. So, Julie, welcome to the 6 Degrees Fireside Chat. It's a pleasure having you here.
Well, thanks. It's a pleasure to be here. And yeah, we can stick on this really too long a bio right now. I'm really old. I apologize. I've done a lot of things over the many years. But the short version is I got bit by policy because I was a Capitol Hill staffer during the Clinton Healthcare Security Act rise and out of a total creativity to go to law school. So I did the lawyering thing for about 13 years before turning back to full-time policy at a couple of think tanks. That was when the Affordable Care Act was born. So worked on economic studies and other sort of here's what's true about the American healthcare system kind of research. And then the Affordable Care Act was passed. And then I was asked to go to the Bipartisan Policy Center to work with former politicians to sort of deal with the fallout from the Affordable Care Act. And then I started consulting for Mike Lovett, among others. So former HHS Secretary Mike Lovett, asked to go into the Cambia Health Solution Planet, which is a parent company that owns about 7 health plans and a whole bunch of digital health companies. As a result, figured out the digital health side in order to help there. And so that's what I did. And it led to Maverick Health Policy. We are a business consulting firm, basically telling healthcare organizations and telling companies about venture capital firms and us because the lawyers need to know about this too. So yeah, there's a lot there, but mostly Maverick Health Policy is following what's going on inside the Beltway on so many issues. So we're getting presentation after presentation as Heath already angst is real. And so if we go to that that first slide, I think there's a title slide that's next, Lindsay, but not seeing that advance yet. Are you, Heath?
It is. I think there may
There we
be a
go.
little bit of a
Delay.
connection issue on your side, Julie. So maybe
Oh,
try going without your video and see if that helps clear up some bandwidth.
yeah, hold on a second. Okay, am I reconnected?
Yeah, you're still there. I still see your video and I can hear your audio.
Okay. Okay. Well, let's see if this works, but stop me if it doesn't, I'll go off video.
Yeah,
So,
no, that sounds much better.
okay, great. Sorry about that. So yeah, if we go to the first slide, we will talk about that the next slide, Lindsay, has a bunch of themes on it. We basically are talking to a number of folks about how this transition of power in Washington, D.C. is impacting the health and tech world. Again, third presentation today. So we basically tell groups what's happening inside the Beltway, and it comes down to a number of themes. One theme, obviously, is uncertainty. Nobody knows what will happen next. It's a real struggle for companies and their organizations and leaders to plan. Another theme that's not on here is reinvention. We are witnessing not just a regular transition of power, not just a flurry of activity, though there is that. What we are witnessing is a series of moves to change the balance of power shared by the public sector and the private sector. It's really a concerted effort to shrink the federal government through a reduced workforce, right? A deregulatory agenda. And really that will, I think, amount to a change in the balance of power from the federal government to the private sector. It is about bringing the high performance management culture of Silicon Valley to the federal government. So where you were once dealing with this broad federal bureaucracy, you're now dealing with a strong power center. So a deregulatory agenda with non-traditional leaders makes for a lot of uncertainty. So those are the first couple of slides. We are also looking at the next theme, which is really about Congress and its unfinished health policy agenda. We are seeing that Congress is really involved in its budget negotiations. It has to get through the debt ceiling conversation. So healthcare is not top of mind. There are a couple of things we're going to address in those budget conversations, but mostly it's not sort of a healthcare discussion. As a result of Congress sort of being wound up in those budget discussions, the states are going to act. The states are not going to wait for the federal government to act. The states are going to go ahead and respond to what they're hearing from their constituencies. And so we are seeing a lot of activity from the state legislatures, particularly in our space, the digital health space, mostly on health AI. So I guess the last thing I will say is that there is very significant activity. So the pace feels rushed, but a lot of that activity is really about instructions to do something rather than things actually happening. So it's kind of this, you know, executive order set of instructions that tell federal agencies or tell other White House staff, go and do this, and 180 days come back and tell us this. But it isn't really something that's going to happen immediately. Even like the regulatory freeze that was put in place, there's 60 days where this administration wanted to take a look under the hood about what the Biden administration was doing. And so we have about 6 weeks left to understand what they are going to do about some of the last minute proposed rules, some of the guidance documents that came out of the Biden administration, in order to know what the Trump administration thinks will stick or what they want to roll back. So these are the kinds of themes that we're seeing in that space. So if we go to the next slide, we will see that this is the healthcare and tech leadership that the Trump administration has put in place. And we just heard just now, yesterday actually, that Robert F. Kennedy Jr.'s nomination to be the next HH secretary made it through committee, where it wasn't clear that that was going to be the case. So there was some fierce opposition, some senators that were definitely on the fence, mostly the Help Committee chairman, the Senate Help Committee chairman, Bill Cassidy from Louisiana, who just wasn't sure. He's a doc. He wasn't sure he was going to vote to see him through, and they have a more full vote of the entire Senate to go. So it's still not a done deal, but it looks like RFK Jr. is going to be our next HHS secretary, which does help, I think, everybody plan a little bit based on what we know about his statements and thoughts, especially on his making America healthy again. Very much a non-traditional medicine play, definitely focus on chronic disease and food as medicine. So it's going to be a very different kind of leadership there. I think he will toss a lot of the sort of regularly scheduled program to others like Dr. Oz and his deputies in order to do the sort of traditional HHS operations.
Hey, Julie, with you know Robert Kennedy Jr. and he talks a lot about the different dyes and chemicals and things that are banned in other countries but allowed here. Is that an area where you can just say, hey, no red dye tomorrow? How long then is it before that kind of stuff is eliminated from our foods, or what's the impact on those initiatives?
Yeah, it's a good question. And there are some things that the HHS secretary can simply can do by fiat, but there's a whole host of other things, particularly what you spoke of, which is an FDA approval process, right? Of either approving or rolling back, regulations and guidance. Like the red dye is actually gone because the FDA did that before he came in, but this is something that it will depend on what the it is, how fast it can happen. Sometimes you have to open up an entire rulemaking process, which can take, a year or more to accomplish. And some things also just can't be done by a federal agency alone. You'll need more authority from Congress in statute in order to give the authority to the federal agencies to do some things. But there's plenty that shifting priorities from one administration to the other allows for, and we'll see what the low-hanging fruit is for this new secretary relatively soon. You want me to keep going? You have a follow-up? Sure.
No.
Yeah, I mean, we put the healthcare and tech leadership up here because there is a truth about this administration, and that is it's incredibly tech savvy, just very heavy on the Silicon Valley types, and they're just kind of throughout. So even this little bit on Medicare's Chris Klomp. So he is the one that is likely to run the Medicare program. And if you look up Chris Klomp, he describes himself as a tech entrepreneur. In the Medicare program, a tech entrepreneur. Like that's just never been said out loud before. So again, the emphasis on tech looms very large. The White House Office of Science and Technology Policy, OSTP, that was a very powerful beast during the first Trump administration, and now will be run by people that are very close to the president. And so that is something else that we're looking at, because they also have healthcare related interests. Even this Russell Vought, OMB director, so that's the White House Office of Management and Budget. Normally, that's just sort of this, kind of a snooze fest. It's a very important White House office, but like nobody pays attention to it because it's basically a rubber stamp of federal agency regulations. It's sort of the coordinator on behalf of the White House to make sure that the federal agencies are in line with the president's priorities. But it really isn't more than, yeah, of course, you can publish that in final form now, kind of a place. And yet, this guy is the one that authored the first artificial intelligence executive order of the first Trump administration. So a fellow who knows an awful lot about AI is running the OMB, which, has to bless transportation, final regulations. It's just kind of an interesting dynamic. So just wanted to call that out. These are interesting times with non-traditional interesting players. And so regular scheduled program is not what we should be expecting. So if we go to the next slide, we can talk a little bit about something else that has been a very early initiative. It started out as a private initiative, as a matter of fact, and after a lawsuit, they quickly pivoted to put it inside the White House offices themselves. So this Department of Governmental Efficiency is what Elon Musk is leading by vision, but this Brad Smith person is leading by staff. He's the sort of captain of the actual work. Elon Musk, I think, is the one that's directing the traffic. But basically, the idea is to shrink the federal government. The initial goals with Vivek Ramaswamy, who is now running for Ohio governor, is basically creating a list of programs that should be cut or slashed or, eliminated. So that's pivoted since its sort of original idea. They changed it from this private initiative to being inside the White House, and they basically took over an existing office that used to be called the U.S. Digital Service, right, which focused on health IT, or not health IT, inside the federal government. So now it's called the U.S. DOGE Service. The U.S. Digital Service no longer exists. And the whole purpose of this thing has shifted from sort of an overall, how do we shrink the federal workforce? How do we reduce the number of regulations, to a streamlining of everything with technology, right? So the modernization of the IT structure inside all of the federal agencies is now supposedly the mission statement. And I say supposedly because it's just not entirely clear. They're doing something that's called the Software Modernization Initiative, but I think we'll hear more about what's actually happening from there soon. I do want to point out that this Brad Smith person has been inside the government and outside the government doing federal health program work. So he worked at the CMS Innovation Center. That's what CMMI stands for. And that is essentially the place that plays with payment models. It's basically the government's portfolio, version, sort of a how do we take Medicare funds and try to make, the dollars last longer with various different economic policies. And so he led that on the inside. And he also started up two very successful companies with former Senate Majority Leader Bill Frist. So that is something that we need to keep in mind, because if you might imagine somebody who knows the ins and outs of the federal healthcare programs that is supposed to be helping to shrink the government is going to be focused on healthcare. So that's something that we're looking out for. So with that, we can move to the next slide, which is less on the digital focus and more on, the traditional healthcare. We know that this administration is not as focused on healthcare in general. It's just not something that is on their top 10 list of things to deal with. But there is still a lot going on in the healthcare financing and delivery space, mostly because we know that there's just going to be a laser-like focus on cutting costs. So that's what Congress is in the midst of doing right now, is trying to figure out how to reduce the costs associated with federal programs. And they're also interested in increasing consumer choice. So for payers, that means Medicare Advantage program is going to do quite well. It's a change in philosophy from sort of traditional to private sector run programs. And Dr. Oz, who is likely to be the next CMS administrator, has expressed support for Medicare Advantage. So did RFK Jr. for that matter. So we expect those MA plans, despite some ongoing scrutiny, to do quite well by this administration. Another space where we're likely to see this push forward for increased consumer choice is this policy known as ICRAs. It stands for Individual Coverage Health Reimbursement Arrangements. And that is a policy that comes from the first Trump administration. I mean, in my mind, it actually comes from former House Budget Chair and then House Speaker Paul Ryan. It allows employers to give their employees money, so a defined contribution as opposed to a benefit plan, defined benefits. So this set of funds would be allowed to buy coverage from the Obamacare marketplace directly. So that's what those ICRAs all are about. We've been noticing that the industry has been preparing for that focus. So Centene, for instance, recently hired a new president to handle ICRAs, and Oscar Health has been advocating for a greater focus on those, and Morgan Health, the JP Morgan employer-based investments, that Morgan Health plans to make several ICRA-related investments this year. So just wanted to flag that. But on overall cutting of costs, it should be no surprise that this administration and this Congress will be interested in reforming Medicaid and the Affordable Care Act. So there'll be expected cuts in both of those programs, and just reducing the size, reducing the subsidies, shifting the money. So that has already been underway, and we expect to be actually part of these budget talks that I've been talking about. Now, for providers, aside from, the expectation that this administration will focus on fraud, waste, and abuse and payment issues, we are going to see probably some activity in the site neutral payment reform space, where things cost, either products or services cost the same amount, no matter where those services or products are provided. So lab tests come to mind. If you get a metabolic panel, done at a ambulatory service center versus inpatient hospital versus a physician clinic, it's all going to cost the same amount of money. That's what site neutral payments is. Right now, that is not true. That same panel will cost, a range depending on which facility you're in. So that's something we expect to come up relatively soon, because again, that's about money, and it's kind of all about money right now. There's not a lot of money. So cutting costs, and one way to do that is to not pay more for a given lab test than you need to. So that's one thing that providers are lobbying about. And another thing is payment cuts, right? So the physician fee schedule just took a hit, and physicians are upset about that and are looking to roll back that cut to pay in the federal programs. So other than that, this cross-cutting issue section is really about issues that cut across both payers and providers. So we're expecting this strong emphasis on individual action, right? RFK Jr. has made it clear that he thinks Chronic disease management should be handled, alongside of traditional healthcare, some non-traditional truths like the food as medicine idea. So we're expecting that to be a top priority for him. And also as part of the Trump administration's push to end the DEI policies, we expect the Biden era DEI policies that sort of strengthened reproductive health access, especially abortion access and gender affirming care access, all of that will be rolled back. So that's already reflected in what's going on in the first few weeks of the administration. So with that, we can move on to the next slide. Yeah, so we focus on digital health at Maverick Health Policy, and we specifically focus a lot right now on health AI issues because that is, a lot of where the action is. There's a lot of uncertainty going on in that space. There was the rescission of the original President Biden executive order. There was a 200-page AI strategic plan that was pushed out by HHS during the Biden administration's last few days, and it's not clear that that will stick. It's pretty clear that the Trump administration is trying to create its own version of a strategic plan. But states are not being slow. They are being fast in what they want to do in that space. But the first two columns here on telehealth and privacy and cyber, telehealth is got a couple of different moments in the early days. One of the things that's hanging out there for the Trump folks to decide is whether the Biden DEA proposed rules that helped create this registration process for opioid treatment is going to stick, or if they're going to roll that back. And then we've got in the budget conversations, Congress is trying to determine whether or not they can extend pandemic era flexibilities for telehealth. I mean, mostly if they decide to roll those back, if they decide that the pre-pandemic telehealth rules should stick, then nobody's grandma can sit on her couch and have a doctor's visit by video. It's basically disallows a home as a site of care for coverage under the Medicare program for telehealth services. So that's a big deal. And not clear if that's going to go through anytime soon. Privacy and cybersecurity are the gifts that just keep on giving. We don't have a national privacy law. And so we are going to see, I think, an uptick in state activity, especially because the way health AI works, it's going to expose a lot more data to attacks. So we are going to likely see some action, particularly by the states, because the feds so far have been utterly unable, despite years of getting close to pass a national privacy law. So we'll see what happens with that. What we get asked about a lot at Maverick Health Policy is the new HIPAA security rule that was proposed by the Biden administration's Office of Civil Rights. It's basically the reaction to the Change Healthcare fiasco, right? Where so many people's records were exposed. 190 million, I think, was the last count. In addition to just shutting down the system for providers, there was just no payments running through the Change Healthcare clearinghouse because they were attacked by a ransomware terrorist. And here we are with a proposed rule, and nobody really knows if the things that the Biden administration's federal agency is going to see through to this administration. So that's one of the things that the regulatory freeze affects is this cybersecurity rule that basically says, everything that Change Healthcare didn't do, you guys now have to do it so that, the healthcare data is not as exposed as it was for that really broad reaching attack. So we're not sure what the Trump administration is going to do about that, but we know with all those tech people in this administration, we should absolutely see some action there one way or the other. They understand quite clearly how important cyber is. So with that, I want to say we seem to be at the end of our slide deck. Is that true? Oh, yeah. So at Maverick Health Policy, we basically have two sets of services. You can hire us to ask hard questions about how the policy world is affecting your business on Tuesdays at 2, right? So we have that sort of regular consulting service business, but we also have this subscription service. So if you don't want to talk to us at Tuesdays at 2, we have a whole website that is devoted to all of our written materials. So including slide decks, right? Including FAQs on the latest thing that just dropped. We have a whole list of executive actions that were taken by this Trump administration that impact healthcare. We have a newsletter that comes out that covers AI and interoperability and privacy and cyber and all the AI investments that we track, and telehealth and value-based care and Medicaid and social determinants of health. We sort of cover the universe of issues. If you are involved in the healthcare system, if you're involved in technology in the healthcare system, if you're a venture capital that invests in these kinds of things, chances are we have covered that issue with the weekly news and the activity inside the Beltway and outside of it. We do a lot of industry news, so you can actually search within our website for Cigna or Aetna or United Healthcare or any of the health systems, anything that has major play in the industry, both from a public policy perspective and a market trend perspective, we put it into the subscription service. So if you're trying to figure out what your go-to news is, we are not a news organization, but we do translate and summarize the heck out of what we're seeing so that you can have that information available to you as well. So with that, Heath, I don't know if we're getting questions in the chat, but happy to.
Well, yeah. So for the audience, Julie's made herself available for Q&A here in the second half of this hour. So feel free to use that function. If you write the question, I'll build it in or ask the question. And one thing that I was just kind of sitting here thinking about, Julie, I know you're traveling this week with some other meetings and presentations, but what are the people you're out meeting with? I mean, what concerns do they have? Like, what are people talking about? And are there things that people are excited about?
Yeah, I think the primary overall truth about people outside, well, both inside and outside the Beltway, is just this uncertainty theme that we started with. People don't know what they don't know. The flurry of activity has been insanely difficult to keep up with, even if you have a team of 10 like I do to feed a whole, subscription service about it. It's very difficult to keep up with it. And so I think I'm at a lawyer conference now. The lawyers are hearing from clients about what they don't understand about what they're supposed to do next. The organizations of our time in healthcare tech space, I think see both opportunities and challenges, but definitely don't know what they're supposed to take seriously, right? That was a regulation out of the Biden era. If they think Trump is going to roll it back, or they've made noise about rolling it back, like it's very difficult to sort of plan, good or bad, right? Like everyone wants to take advantage of a more open-minded, sort of innovative, lower regulatory era. And yet it's not clear if that's going to come back to bite you in the form of litigation, right? So regulation is cuts both ways. It's something that you have to comply with, and it's annoying, but it is something that you can hide behind if somebody tries to sue you for something and you're just complying with a regulation. If there is no regulation, the liability looms pretty large. So there's some seriously large and small companies that are nervous about sort of going into the abyss without understanding what that means for them if, somebody is angry about what they decided to do with a service or a product. So yeah, there's a lot. And it also depends on who you talk to. So if you're in a room full of health plans, for instance, they just want to talk about the backlash since the Brian Thompson healthcare CEO, murder back in December. That is just an all-encompassing focus for health plans at the moment in a number of different ways. One is just sort of how do you rectify, an already difficult reputation as those companies, but also how do you move forward on some of the things that was apparently about. So prior authorization, right? Coverage determinations and how those are made and how to move forward on that. We're seeing, for instance, Cigna being the latest example of what they're doing about the anger that was so public after the Brian Thompson assassination. So it's planning, apparently, Cigna's apparently making changes to improve the patient and physician experience, they say, particularly around coverage transparency and the prior authorization process for submitting claims. And that's, really going to be kind of eliminating the information gaps play, right? So they have prior authorization requirements and they're going to have a more open dialogue, they say, with their provider network in order to make sure that those prior authorization submissions go through and are approved. Another thing they said they're going to do is publish an annual report. It's called the Consumer Transparency Report. So apparently, beginning in 2026, Cigna is going to provide details on their claim reimbursements, including reasons for denials and steps patients and providers can take to resolve problems with that claim denial. So yeah, it depends on who you ask, Keith, what their sort of top of mind urgent issues are.
Yeah. Yeah, I would assume that the uncertainty is probably a real frustrating point. And, even looking over the last 20 some years that I've been in this space, some of the regulations that come through and the timing of when they actually implement them, I think has always been a factor as well. You hear about the changes that are going to take place, and then you have a date that is set, and then they just keep getting pushed out. I mean, is that something that people are talking about here as well with so much going on, or do you think the Trump administration is going to enact these and enforce them?
Yeah, that's the $1 million question. Right now, the sort of last the things that happened last, but also, policies that were finalized but didn't go into effect, right? So they have dates that are in the future for implementation. All of that's on hold right now. And the whole point of the hold is for this administration's leaders to get in there and look and see what they want to continue and what they don't want to continue. And so it's not clear. It's not going to be clear until they're done with that review and they start to issue proclamations about what will move forward. It's, if you're trying to lobby about some of those policies and you're dealing with a proposed rule like the cybersecurity rule I mentioned, that's a big deal for health plans and health systems. Putting some of the things that are in place in that rule will cost some money. It's sort of a whole big technology play with some of the things that are required in there. It will be a lot of money to get that done. And so if you're a health system or a health plan looking at all of that, you want to comment, right, on that proposed rule. They don't know whether or not they should be commenting. because it's not clear that that's going to see the light of day, right? So it's an interesting moment, but nobody really knows how that's going to move forward. Looks like we had a question in the chat about Cigna. No, I meant Cigna. If you look it up, Cigna actually is just released on all the things that I said about what they're planning on doing about prior auth. They are the subject of litigation the same way United Healthcare is, the same way Humana is. So there's actually 3 lawsuits going on about automated prior authorization and coverage decision processes. 3 ongoing lawsuits. So Cigna is one of them, and Cigna just happens to be the one that said something last about it. So I picked up on Cigna, but it's definitely a United Healthcare thing as well.
Okay. I don't see any other questions that have come in. I really appreciate your time. I don't know if there's any parting thoughts that you had. We got a couple minutes for that. Otherwise, we can wrap up and give everybody a little time back in their day. Julie's contact information is on the screen, and she graciously provided all this information for us today. So if there's something she can help you with, please reach out. You see her email there, julie.barnes@maverickhealthpolicy.com. I'm sure she'd love to hear from you. Otherwise, I will see everybody next month. Keep your eyes open for the invitations for the March Fireside Chat. And until then, happy Valentine's Day to everybody if I don't see you before. So, thank you, Julie. Really appreciate your time. Take care, everybody.
Absolutely.